Welcome back. This is Module 3, and we're talking about infections, focusing on bacterial infections this module, airborne, waterborne, foodborne, and soil-borne. So before we get into the bacterial infections themselves, we're going to talk about infection and how it spreads, and how it works. So we have what is called the chain of infection. And the chain of infection doesn't really have a start or end, but we'll just start here. You have an infectious agent. This infectious agent moves into what is called a reservoir. That reservoir is a human, an animal, anything that is able to support that particular microorganism. That reservoir has to have a portal of exit for that particular infection. For humans, a lot of the time it's body fluids. So anything from urine to blood to droplet spray from coughs or sneezes, sometimes fecal matter. This is portal of exit, a way for the infectious agent to leave that reservoir. The mode of transmission, so if the portal of exit was how it left, let's say through the mouth, that mode of transmission could be droplet sprays from the mouth. It could be sputum from the mouth. It could be cough that causes a droplet spray from the mouth. Then there has to be a portal of entry somewhere else. So if we're still talking about the same type of scenario, we're looking at someone else's mouth, okay? And then a susceptible host, which is a host that can support that particular microorganism, allow them to grow and be susceptible to that infection. Back to the infectious agent. And it'll continue to go in this cycle, okay? So to infect or not to infect, let's talk about why it is that some people get sick when they are exposed to particular microorganisms. Some people don't get sick when they're exposed to certain microorganisms. Infection itself is the state or condition where the body is actually invaded by a pathogenic agent and causing favorable conditions so that whatever that pathogen is can multiply and cause some type of damage to the host. So a true pathogen is going to be the type of pathogen that one would expect to actually cause illness in healthy individuals, whereas an opportunistic pathogen is going to be a pathogen that, generally speaking, a healthy individual would be able to resist or be able to fight off. However, an individual with an an individual with a compromised immune system might not be able to fight it off. And a lot of the time it's going to be normal flora for your body. So just normal organisms that are found all over your body that are developing into a pathogenic role and taking advantage of a compromised immune system. So how does this work? There is something called the virulence of an organism, which is its ability to cause disease. So these are all factors that are going to contribute to whether or not a particular microorganism can actually infect the host. So the virulence is the way or the ability of a particular microorganism to cause a disease. So a pathogen then is an organism that is capable of causing a disease. Virulence is its ability to do so. And then there are some that are what are called drug fast, which means that they're resistant to pharmaceuticals, something like MRSA, which is, we talked about this in one of our last cases. MRSA is resistant to penicillin, resistant to treatments, and will continue to grow even in unfavorable conditions. The portal entry makes a big difference as to whether or not an individual becomes infected. So if I'm standing close to you and I'm talking to you and you cough, I'm more likely to get that pathogen into my nose and into my mouth where something can infect me in that rate. However, if I'm kind of turned the other way and I'm listening to something else and I'm looking in another direction and you cough, if that pathogen enters my ear, although you can still get ear infections and that type of thing, it's depending on the pathogen, it may be less likely to infect me if it went in through my ear than it would be if it went in through my mouth, okay? The number of organisms that are present in whatever you were exposed to are also going to make a big difference as to whether or not you get sick. If you're exposed to an organism count of 100,000, generally you're probably going to be more likely to get sick than if you're exposed to a count of 10. That's because those organisms have more of a chance of taking hold before they die in your system. And the resistance of the host themselves is going to make a big difference. We all have different functioning immune systems, and we all have different immunities and ways of fighting off infection. So the resistance is going to be defined as the sum total of body mechanisms that cause barriers to the multiplication and of a particular microorganism or the damage that their toxins produced. So this is the thought behind vaccines, is to develop resistance to certain types of infections. So types of infections. You have two different types, exogenous and endogenous. Exo meaning outside, endo meaning inside. Therefore, exo contamination from outside of the body, endo contamination being from inside of the body. Now, outside of the body is easy enough to explain, but how are you getting infections from the inside of your body? Well, generally it's translocation of some type of microorganism from one area to another. So normal flora not knowing its own role. You also have what are called communicable diseases. And that is a disease that'll spread from one host to another host, either directly, so you're getting it, directly from the mouth spray into your mouth, or indirectly. So you've gotten, I've gotten some mouth spray on a countertop, you've put your hand on a countertop, you've rubbed your face, and then suddenly you're sick. Okay? So communicable diseases can be broken down into 4 different categories. An endemic is when a particular region has a constant underlying sickness, but it's generally a low mortality rate. So things like colds that are constantly within a population of a particular region, but not really huge killers, okay? Sporadic is when something occasionally occurs in a particular region. So every once in a while, you'll see the bubonic plague. And yes, you will still see the bubonic plague. We're going to talk about the bubonic plague. So every once in a while, you might see an outbreak of one individual that has the bubonic plague in a particular area, but it's not something that's usually spread throughout a population. It's something that's generally contained back to one person. So that's going to be sporadic contamination. An epidemic is going to affect a large population all at the same time. This is not bacterial or anything else, but you'll often hear people talking about the obesity epidemic. And if obesity is considered to be a pathogenic state, and there is a large population in one particular area, like the United States, where there is quite a number of obese individuals, then that is a large population in the same area that is affected. Pandemic is going to affect the majority of people in a very large region. It's generally referred to as a global epidemic. Okay, so globally, if influenza is taking hold on a global scale, it doesn't, it runs in cycles, but let's just say influenza is taking place on a global scale. That would be a pandemic. And obviously, when we're talking about pandemics, we're talking about zombies. Zombies will happen on a global scale. No, I'm kidding. I'm messing with you. All right, so the types of infections, local, focal, and general. Oh my. All right. A local infection is going to be an infection in one particular part of the body and tissue. So if it is contained to one specific spot, then you'll have what is called a local infection. A focal infection starts out as a local infection, let's say an infection in the teeth, like what is shown here. But then it gets into the bloodstream or the lymph stream and spreads throughout the body. So here we started off with a tooth infection that got into the bloodstream and started to infect the lungs, the heart, we've got the liver, and we've got the intestinal system. Okay. Then a general infection is referred to as a systemic infection, something that is throughout your entire system. And here's an example of an individual with lupus who has an infection throughout his entire system, causing a rash that is throughout the entire body. You have primary, secondary, and mixed infections. So a primary infection is going to be an acute infection that causes a primary illness. So let's say an individual contracts HIV. HIV is going to be the primary infection that causes the initial illness, and the initial illness being a compromised immune system. Secondary infection is an immune system weakened by the primary infection. The host becomes susceptible to infection from another agent. So there is a particular type of cancer, Kaposi's sarcoma, that is generally not found in healthy individuals. However, individuals that have contracted HIV with their compromised immune system, they're susceptible to the causative agents of Kaposi's sarcoma. So they end up with these lesions, just like what's pictured here, all over the body. And mixed are going to be infections caused by one or more agents. So like if a human bites you, and there are multiple types of infection that can be found in the human mouth. There are so many bacteria in the human mouth, it's not even funny. So all of these different types of bacteria found their way into your skin, and you're being infected by not one, but several different types of bacteria. So obviously we're talking about zombies again, and I am not going to get off the zombie kick. It's just not going to happen. You can have blood infections. You can have, if you have viruses that are in your blood, it's referred to as viremia. If you have bacteria that's in your blood, it's referred to as bacteremia. And septicemia is when those bacteria that make it into the blood start to multiply in the blood and grow and thrive. Multiplying bacteria in the blood, you've got septicemia. Toxemia is when the poisoning products move throughout the entire body that started from a focal point. So we talked about earlier, that tooth infection that moved into the bloodstream and then moved out through the different parts of the body, infecting the lungs, infecting the heart, infecting the liver, blah, 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 blah. Toxemia is that distribution of those poisonous products, okay? So here we have an example of complications due to septicemia, the multiplication of bacteria within the blood of that particular system. So there are, as we talked about a little bit, there are many factors that affect the virulence of a particular microorganism. And when we look at this, first of all, we want to look at how capable is that microorganism of producing toxins that are going to cause harm to the host. So there are two different types of toxins that they can produce. There is an endotoxin, endo meaning inside, exotoxin, exo meaning outside, and endotoxin, toxin meaning inside. So an exotoxin is going to be produced by the microorganism, and then it's going to be kind of released out into its environment, whereas an endotoxin is something that's contained within the microorganism, but as that microorganism starts to break down, then that toxin is released into the system. Microorganisms are also capable of creating enzymes that will make certain human tissues, that will damage certain tissues. And they're also capable, some of them, of creating layers to protect themselves. So if they can produce spores or capsules, which we've talked about previously, if they can produce spores or capsules to help them in an environment that is not ideal for that particular microorganism, then they have the ability to withstand a lot of different things. They have the ability to withstand an adverse environment, which is going to make them far more capable of causing infection. So let's talk about how disease actually spreads. Now, we talked about the general system in which the disease spreads, but there are three usual sources of infections. First of all, animals or people that have the infection to begin with. So people that are in the midst of an active infection are generally infectious, meaning that they're able to spread that particular illness. Chronic animal or person carriers, meaning that the individual is carrying that particular contamination, but they're asymptomatic. So they may not even realize that they're carrying it. And then you can get environmental contamination. But these little suckers right here, goats, man, I'm telling you. There are different types of reservoirs, and we talked about reservoirs a little bit earlier, but let's get a little bit more into this. Human reservoirs. Human to human is easier to control through behavioral modification using universal precautions. We have gone over universal precautions ad nauseum, so I'm not going to take you through all of that again. But through behavioral modification are things like wearing gloves when we know we're going to be in an infectious environment, or something as simple like, if even not on a clinical level, some behavioral adjustments, such as instead of coughing and putting your hand over your mouth, you cough into the crook of your arm, so that when you're touching things, you're not spreading it. It's just right there in the crook of your arm. Okay. Animals are obviously a little bit more difficult to control. You cannot reason with them. You cannot explain things to them. Such a pain. You can get infections, especially through vermin, mice, rats, insects, that type of thing. And then food sources. So salmonella is a common problem that we're exposed to through food sources. And then you have what are called environmental reservoirs, things in the environment that are causing disease. So contaminated water or soil is a big one. Flint, Michigan, which is where I was born, actually. Flint, Michigan has been in the news a lot lately for the lead contamination in their water from switching water sources, and then one of the treatment chemicals within that water source degrades the pipes that the water travels through, thus all of the old lead pipes that are in a lot of the homes within the Flint area have degraded to the point where you end up with lead contamination in the water. And with that, another portion of that issue that wasn't really addressed was that change in water source actually also introduced what was called Legionnaire's disease into the population. And Legionnaire's disease, we'll talk about in a little bit. I won't get too far into it right now. But Legionnaire's disease can be deadly, especially in children. And that actually spread through the population of Flint, Michigan as well. And then you have things like botulism and tetanus that are found in soil or metal objects that can be spread very easily if your skin is compromised by a metal object and you get soil into that particular lesion, then you can be exposed to a lot of different contaminations. Now, there are several things that, well, there are two ways of transmitting disease. There is direct transmission and there is indirect transmission. We started to talk about this a little bit earlier. But person-to-person contact, whether it's casual or intimate, so whether it's just me touching your hand or if it's me kissing somebody, person-to-person contact is going to be a mode of quote-unquote direct transmission. The organism itself is going to determine whether, how that particular transmission takes place. So most common ways of direct transmission are going to be sexual transmission or fecal-oral transmission. And I know what you're thinking. I know what you're thinking. You're like, how is fecal-oral going to be one of the most common modes of transmission? Holy cow, who's walking around eating poop? That's not what's happening here. Fecal-oral transmission can happen from something as simple as a child not washing their hands after using the restroom. It can happen from, a parent who is in contact with a child that didn't wash their hands after using the restroom. Someone who has changed a diaper and not realize, not thought about it, not sanitized their hands afterwards. So nobody's walking around eating poop to my knowledge. Well, okay, I'm sure somebody is walking around eating poop, but that's neither here nor there. But generally, it is some type of cross-contamination for fecal-oral. And then the other modes of transmission are going to be oral-oral, skin-to-skin, and blood-to-blood. So if you've got a BFF and you're trying to do a blood pact, not ideal mode of transmission, okay? Indirect transmission can come from food and water, contaminated food and water. It can come from air, and it can come from what are called zoonoses, which means an animal to human transmission. And arthropods, these little suckers, are huge culprits for the insect bites, the animal to human transmission. Mosquitoes, ticks, mites, lice, fleas. So here is an example of why it is considered to be an indirect transmission. So what we have here is a little flea dude, okay? A little blood-sucking arthropod. He's sucking blood, but he's not spreading the disease by sucking your blood. He's actually getting the disease from somebody by sucking the blood. So this contaminated red blood cell here is getting sucked up into this poor little dude, and it's ending up in little dude's system, okay? Then little dude jumps from one person to another person, and he's getting another meal. And when he gets his next meal, little dude has to expel the first meal, okay? So little dude has relieved himself upon your skin. Now, it could be, depending on the type of contamination, either compromised skin, or it could be a type of bacteria that is able to penetrate skin. But this moves into the dermis, starts hanging out, starts getting into the capillaries, not cool, and then starts moving its way into the bloodstream. And then the next little dude sucks it up. Okay, so that's why it is indirect transmission instead of direct transmission, because you're not getting it directly from the bite. There are things called vectors, and vectors are going to be a contaminated animal or object that's carrying a disease that leads to an infection. Okay, biological vectors are going to be diseases developed in an animal before infecting a susceptible human. So we've got our little fly dude here. No, never mind, that's my next example. So mosquitoes and malaria. Mosquitoes will get malaria, develop it within their systems, then spread it to the host through, actually through their blood-sucking habits. Mechanical vectors are diseases that do not develop inside of the animal, but the animal still spreads the disease anyway. So now we're back to this little dude, Mr. Fly. I can't write. Fly. Nah, okay, I'm just not going to write it. So Mr. Fly over here landed on a big old pile of poo. And then Mr. Fly then lands on your food. So whatever was in that big old pile of poo was all over Mr. Fly's little legs. All right. And whatever was all over Mr. Fly's little legs and the bottom of Mr. Fly's little body is now all over your delicious cheeseburger. And even though you shooed him away, he still contaminated the top of your cheeseburger because Mr. Fly is a jerk. All right. So whatever was in that fecal matter that can contaminate you is now on your food. You ingest that, you become contaminated. That is the means of a mechanical vector, not necessarily a machine, but something that is transmitting a disease without actually being infected with that disease. So in order for you to become infected with a disease, you have to have what is called a portal of entry. And a portal of entry is the ability for a particular contaminant to enter your system. It can enter through skin and mucous membranes, okay? Any type of open wound, scratch, abrasion, or doing something as simple as contaminating your hands and rubbing your face and getting something in your nose, in your eyes, in your mouth, in your ears, anywhere. Get them through your respiratory tract. So any type of airborne pathogens. We talked a lot about droplet sprays, sneezing, coughing, contaminated hands and nose and mouth. You can get them through your digestive tract, so ingesting things and swallowing contaminated food or water, getting into your tummy, all kinds of nastiness. Genitourinary tract, so we're talking about STIs, contaminated hands in that particular area. One that's not generally spoken about as much is placental. Okay, so there are some diseases that are capable of crossing that placental barrier and making it into little dude bro here. Okay. And then there are always exit vehicles, any fluid or substance coming out of the body that is able to share that contamination. So it can come out of any number of places. It can come out of your nose in the form of mucus. It can come out of your mouth in form of droplet sprays, tears from your eyes, discharge from your ears, and discharge from other orifices. An individual's ability to resist infection comes from a number of different places. So you've got, first of all, what are called mechanical defenses. This is your first line of defense against any type of contamination. Skin, skin, skin. So there is a term called necrobiosis. And necrobiosis is actually incredibly helpful in keeping contamination away from your skin, or keeping it from soaking into your skin and keeping it from becoming a systemic contamination. So necrobiosis is the process in which your epithelial cells die off, slough off, and replace themselves on a regular basis. Average human is losing a ton of skin every day. In fact, the majority of dust that you're going to find in your house is going to be the product of skin sloughing. So every time you dust your cabinet, just think about the fact that you're just dusting a whole bunch of dead skin off. Pleasant housework. All right. So this helps from keeping you from getting contaminated, because the contaminants are going to hit the top portion of your skin. And if that top portion of your skin is sloughing off on a regular basis and running away from you, then that contamination is going with it, and it doesn't have a chance to actually soak into your system. Tears will flush contaminants from your eyes, so the production of tears will get everything out of this little cavity and bring it right out of your inner canthus. Eyelashes, nose hairs, and other body hairs. You know, a lot of people give people crap about not trimming their nose hairs, but those that are not trimming their nose hairs, I bet, are getting far fewer respiratory infections than those who are trimming their nose hairs, due to the fact that nose hairs have that purpose of keeping infection out of your system. So whatever you're sucking in is getting trapped in those nose hairs. It's getting surrounded by mucus, and then it's being discharged before it has a chance to contaminate your system. Other cilia, like eyelashes, will do the same thing. It's going to catch a contaminant before it ends up in your eye. Sometimes. Anybody who's ever had anything in their eye knows that it doesn't work all the time. And then urine, which is going to flush out the urinary tract. Then you have physiological resistance, and this is a little more complicated, obviously, than mechanical resistance. One of the body's defenses is going to be inflammation. And I know what you're thinking. You're thinking, we tend to try to fight inflammation a lot of the time. That's because of the discomfort to the host, not because it's not doing its job. So what happens in inflammation is that the immune system draws cells called leukocytes to the source of the contamination to try to fight that contamination. So all of those cells are going, oh, hey, dude, there's something here that does not belong. We've got to get over here. We've got to envelop that, and we got to get it out of here. Okay? So these leukocytes all rush to the area. Then they create a amount of pressure in that area. So the rushing of leukocytes in that area causes that inflammation and causes pressure. And what that pressure is going to do is, where this open wound is, okay, what that pressure is going to do is get to the point where it's trying to actually expel that contamination through that pressurized area. Okay. One prime example of this that we've all had to deal with from time to time is going to be a pimple. All right, you've got some sort of contamination that got caught in a pore, and all those leukocytes rushed over, and they're like, oh, no, dude, you don't belong here. And then the inflammation starts around it. It gets all puffy and ready to go, and then eventually that pore expels pus-covered yuckness. Okay? So heat, swelling, pain, redness, loss of function, all signs of inflammation. Fever is actually a defense as well. So what happens during a fever is that blood from the superficial vessels, like capillaries, will then move into the core vessels in order to increase body temperature. That increase in body temperature is there specifically because a lot of microorganisms can't survive an increase in body temperature. If you think about it, your body at a normal temperature runs at 98.6 degrees. It's already a pretty high temperature for bacteria. If you get that temperature up to 100 degrees or 102 degrees, somewhere in that area, if you get that type of fever in your system, that already high temperature, that you're already on the higher range of what a lot of microorganisms will tolerate, that little change in temperature could be enough to actually kill off and get past what they would be able to survive in. And then there are these sweet little dudes called phagocytosis. Okay, these are bone marrow cells that break down foreign cells and debris, and a phagocyte will actually engulf a foreign object and move it to a place where it can be expelled from a body. So it does kind of the same thing that a leukocyte would do. Your body also has a way of producing chemicals that will fight infections. That will fight infections. All right, these chemicals work in various different ways. First of all, we produce mucus, like this dude over here. All right, we produce mucus that will encompass a lot of the contamination and expel it out of certain areas of our body. We have these cool things called lysozymes, which are enzymes that break down cell walls. They're found in tears, breast milk, saliva, sweat. And what these do is they attack the contaminants, break down the cell walls, and kill them before they have a chance to infect us. Pretty cool little dudes. Gastric juices are highly acidic, and as we know that a lot of pathogens can't survive in highly acidic environments. And this is one of our GI tract's attempts to keep our system safe by anything that we ingest is going to be subjected to that acidic environment, and a good portion of what we ingest isn't going to contaminate us because of it. Then we have these dudes called interferons. And what these fun little dudes do is they bind the surface receptor of uninfected cells to prevent viral reproduction. So these little interferons sit here and block off the areas of a cell that would typically be bound to these viruses. So the virus tries to get in, they're like, no, dude. There we go. They're like, no, dude, can't come in, can't play, can't stay here. Okay. We also have the human immune system. Okay. There are three groups of people that are generally more susceptible to infection than the rest of the population. That would be children, because they haven't fully developed their immune system yet. The elderly, because their immune systems tend to degrade over time. And then the immunocompromised, which are individuals that from any other type of disease process have had an immune system that isn't fully functioning. Okay. The rest of us in the population that have healthy immune systems produce lots of antibodies to fight what are called antigens. Okay. So antibodies are the immunoglobulins that respond to antigens. So here we have an antigen right here on the edge of a particular pathogen. Okay. And these pathogens try to attach themselves to cells with these little antigens here, these little antibodies. What an antibody does is it comes over and attaches itself instead to these particular antigens, keeping it from binding to another cell. Okay. So this is actually a cycle. These antigens actually stimulate the growth of antibodies in the body. So these little antigens are triggering these antibodies to start growing and making their way through the system. And antigens are also little markers that tell, the body where a particular cell belongs. So if it belongs in the digestive tract, if it belongs in the respiratory tract, if this little dude moves out of that area, these little antibodies are like, no, dude, binding myself to you. Okay. So this is the theory behind why vaccines work. What they'll do is they'll actually introduce, in some vaccines, inactive or dead contaminants that will stimulate the growth of antibodies in the system. And these antibodies continue to exist so that when a live version of that gets introduced into your system, you're not as susceptible to it. Okay? There are two types of immunity. One is innate and one is acquired. Innate means that you are born with a particular type of immunity. You didn't do anything special, you didn't earn it, you just got it. And there are particular diseases that are infectious to one particular gender or one particular race. For example, Kennedy's disease. Kennedy's disease is a genetic disorder, but it is found only in males. It is not found in females. So females have an innate immunity to that particular disease. Then we have acquired immunity, which is the formation of antibodies to certain pathogens. So your body has been exposed to that before. It's created antigens to keep it out of your system and will fight any further infections. So as we just talked about, vaccines. Okay, all right. So now that we've talked about how infection takes place and we've talked about resistance, we're going to talk about some particular bacterial diseases. All right. Now, we will be going over specific bacterial diseases because this is, first of all, important to you as an embalmer to be able to recognize some of the things that you'll be exposed to know how to fight those particular infections and know how to keep yourself safe from those infections. And another reason being is that there are specific diseases that you will be tested on in your national exam. So the ones that we're covering are the ones that you're required to know for your national exam, and also the ones that are particularly helpful to know in the preparation room because there are things that you could possibly be exposed to. So bacterial diseases have long been a significant cause of disease within the human population. Some of them can be treated with antibiotics. Some of them have become resistant to antibiotics, such as MRSA. We talked about that before. And with bacterial diseases, there's such a vast variety of them that new diseases are being discovered on a pretty regular basis. Okay. So the first group of diseases that we're going to talk about are Staphylococci. Okay. Staph meaning cluster, as you recall from our first lecture. Cocci meaning round, as you recall from our first lecture. So here we have Staphylococci are often described as bunches of grapes, okay, because of the way that they stain. They stain, their gram stain gives them that purplish effect. And they look just like little clusters of grapes, okay? So Staphylococci are anaerobic, meaning meaning non, aerobic, meaning air. So they don't like air. They don't like oxygen. They don't form spores. They are normal flora. They're found on skin and mucous membranes, and they gather in mucous membranes around the nose. But as we know, normal flora can have a problem finding its role sometimes and can become infectious if it's got too much of it in the system or if it's in the wrong place. Okay? So first of all, we have Staphylococcus aureus. Okay. This is one of the most common types of staph infections, and it creates lots of toxins to a particular human host. Even after a bacteria has been killed, the toxin that it produces can still be present in the system. So even if you get a staph infection and you kill that particular infection, you may still have the effects of that infection for a considerable period of time because the toxins that have been produced are still in the system. So they can survive gastric juices, these toxins can, and some will actually attack the platelets in your system that causes clotting failure. So you'll end up with a cut or something like that that won't stop bleeding. It's kind of an equivalent to a blood thinner. Okay. It also creates nasty, nasty, nasty little enzymes, and we talked about enzymes being able to compromise tissues. So it creates three specific enzymes. There is coagulase, which causes the blood to clot. There is hydrogenase, which penetrates connective tissue, allowing infections to actually move into the connective tissues of the body. And then there is lipase, which works with the oils and fats in the sebaceous glands, and it actually allows the infection to resist because of the oils and fats in the sebaceous glands. Staph can cause foodborne illnesses, but generally, if something is cooked to temperature, Staph aureosis can't survive standard cooking heat. But in cases where you've got improper food handling, and especially when you've got communal food environments like potlucks, family gatherings, that type of thing, food can lose its temperature. It can become recontaminated by the number of people that are handling the food, whether it be the people serving the food or the people getting the food, and the food can become recontaminated. And then once the food is contaminated, although the cooking temperatures can actually kill the contamination itself, like I said, the toxins can sometimes still be present. So reheating, if you've got food that you had up to temperature, but it actually didn't get back down, or it got back down and you got it back up to temperature, you can still kill the bacteria, no problem. Killing the toxins doesn't work. Okay? So foodborne illness can cause digestive distress, diarrhea, vomiting. Generally speaking, you're going to recover within a day, but anything that you're going to have, any symptoms that you're going to have after that is usually a result of dehydration from the nausea and vomiting. Can also cause skin and wound infections. It can cause toxic shock syndrome. So what happens a lot of the time when you get staph infections on the skin is that the staph infection moves through the hair follicles, and it's going to cause a little bit of a pimple, okay? These pimples can get more serious, and you end up with what is called a furnicle or a boil. And what happens there is that the tissue becomes extremely inflamed, it becomes full of pus, there's some necrotic tissue in there, and the blood vessels that actually feed that particular area start to clot, and they form what is called the core, which is a hard core inside of that pimple. And if you pop it, not just pus comes out, but you get a hard mass that comes out with it. And what's even worse is a carbuncle. Okay, and what happens with a carbuncle is that all of this is spreading to surrounding tissues. So instead of a spot like this or a spot like this, you're going to get this huge spot. Okay, it's going to spread out through those surrounding tissues. You might have a core in this particular area, but it is spread all the way out into other areas. And these particular types of infections are going to require some topical disinfection when you're embalming. Toxic shock syndrome is when tissue inside of the body is compromised, then infected, and the infection spreads throughout the body. Toxic shock syndrome is generally associated with the use of tampons in females. So what will happen is the tampon that is used adheres to the uterine lining, adheres to the vaginal wall. And that adhesion, when you pull the tampon out, causes rips or tears in that vaginal wall. And then any insertion of anything else, like a new tampon or the applicator for a new tampon, can introduce the staph infection into that area, and that broken skin is susceptible to that. So with that susceptibility, or with that staph infection, it then moves throughout the entire body, causing the body to go into shock. You get high fever, rash, diarrhea, vomiting, dehydration, severe hypotension, and in about 5% of people, it can actually be fatal. It can also be a post-surgical complication, but it is most often associated with tampon use. Then we have what are called nosocomial infections. And nosocomial infections are infections that are received from the environment around you, generally a clinical setting. This can refer to hospitals, or it can refer to your preparation room, okay? Nosocomial infections can be secondary infections from flu, individuals that were drug users, individuals with fever. So if you watch for areas of localized swelling, those are areas that you can be susceptible to nosocomial infections. I just thought this was cute. The hospital staff. Got MRSA hanging out right here. You got support staff. I don't know what strep is doing there, because obviously strep is not a staph infection. But hey, we can't all be perfect, right? But now we're moving on to strep. So maybe it was just an introduction to our next module. All right, so my dog, Ralph Waldo Emerson here, has decided to join us for our lecture. Emmy, go on. Okay. All right. Emmy has decided that he no longer wants to be part of the lecture. So we are looking at Streptococcus now. Streptococcus is a gram-positive contaminant, and it creates both toxins and enzymes. And many of these species are going to be saprophytes. And as we remember from our previous lecture, saprophytes feed on dead human tissue. Okay. One of the types that we have is going to be Streptococcus. I'm going to struggle with these names throughout this entire lecture, you guys. Eglosate. So this is going to be one of the leading causes of sepsis in newborn babies, because this is found often in raw milk, and obviously raw milk is what we're using to feed newborns. It's also the primary cause of uterine infections postpartum. So any postpartum infection from the uterus is general. All right, hang on, I got to get rid of the dog. Okay, Emerson has been moved to the other side of the room now. So the infection of sepsis in newborn can cause lethargy, jaundice, respiratory distress, shock, pneumonia, and anorexia in newborns. Okay. Pneumococcal meningitis is also a Streptococcus infection. It's the most common cause. There are several causes of bacterial meningitis, but this is the most common one in adults. generally found in the nose, throat, and it can form capsules. So, as we discussed before, the formation of capsules means that it can survive in harsh environments or non-ideal environments quite easily, which makes it more virulent. This particular strain is highly virulent. It has a 40% mortality rate and is generally treated with penicillin. Otis media is going to be an inner ear infection caused by S. pneumoniae, Streptococcus pneumoniae. There are vaccines available for otis media, and the treatment is going to be penicillin for that. There is what is called lobar pneumonia, which is generally what people refer to as just pneumonia. And that is pneumonia that is isolated in one particular lobe of the lung where the infection begins. If it moves into the other lung, then it's generally referred to as double pneumonia. So a pneumonial infection in one lung, pneumonia. A lobar pneumonial infection in both lungs, double pneumonia. Symptoms that you'll see are going to be acute onset fever, chills, difficulty breathing, chest pain, bloody sputum. And it involves adenomous fluid that is developing in the bronchi and alveoli. So this buildup of fluid is causing that congestion and inability to breathe. And usually it shows up as a secondary infection. So most people, if you've ever had pneumonia, and I have had it, pneumonia, a lot of the time will start off with, okay, I have a cold, then my immune system is going to be compromised, then I end up with pneumonia. So the cold itself didn't cause the pneumonia, but it compromised your immune system to the point where it becomes susceptible to the secondary infection. Strep throat is one of the most common associated with the Streptococcus strain. And it is caused by Streptococcus pyogenes, and it produces both enzymes and toxins. So usually about 4 days after exposure, you start to see symptoms, and it comes in phases. So the first phase is going to be developing headaches, nausea, vomiting, sore throat, malaise, fever, and then you get this kind of mucousy looking coating and swollen tonsils in the area. Like right here, you can't even see the back of the throat, okay? It's generally spread by droplets in close contact, and it's treated with antibiotics. Impetigo is kind of a lesser known infection, but it's actually fairly common, caused by Streptococcus pyogenes. And it starts with small vesicles that develop into weeping lesions, okay? And after several days, these lesions start to form a crust and dries, commonly spread through insect bites, contaminated hands, and compromised skin. So here are the lesions that we're talking about. Okay, they look like little pimples all over the body, and they start to crust over because what's happening is that the infection is being expelled, creating that pus, because you see the inflammation around there. Scarlet fever is also caused by S. pyogenes, and it's called scarlet fever because it produces a reddening toxin, causes inflammation in the throat. And what you end up with is what's called a strawberry tongue, and it is a very red, inflamed, spotted tongue, okay? You'll also end up with desquamation on the affected skin. You get it from inhalation of droplet spray, and it's treated with penicillin and antibiotics. Several types of fever are also associated with Streptococcus. You've got rheumatic fever, which is an autoimmune condition. Generally affects individuals from age 4 to 18. And what it is a type of arthritis that is, you form these nodules within the joints, and that arthritis is caused by those nodules that'll end up in the joints. Sometimes when it gets a little bit further on, it leads to inflammation of the heart valves, which is then going to be referred to as rheumatic heart disease. And synonyms cholera, which is called chorea, I'm sorry, called St. Vitus's dance, happens in about 10% of the cases where um, they seem to have purposeless motion. They've got very involuntary movements. And this is going to be happening while the individual is awake. And what this is a sign that the infection has moved into the central nervous system, causing these involuntary movements. S. pyogenes and also causes a perpetual sepsis called childbirth fever. Nosocomial infection, and remember we talked about nosocomial meaning that it comes from clinical settings, happens after childbirth or abortion. And once again, this a compromised vaginal wall opens up the ability for infection to be able to set in. Generally comes from contaminated surgical instruments, and then it spreads from the uterus to the abdominal cavity, causing a lot of pain and a lot of cramping. And it's generally treated with antibiotic or penicillin. Neisseria gonorrhoeae is an STD, also referred to as gonorrhea, and it is spread through all forms of sexual contact. And humans are actually the only natural host for this particular disease, so it's not an animal born or anything else. Now, this is particularly virulent because it will form not only a capsule, but then it has pili to be able to be motile. You've got cell wall proteins and endotoxins and enzymes all created by this particular infection. So it's going to make it very, very virulent, okay? It is the most reported STD in the United States. Symptoms are going to be pustular discharge from the genital area, painful urination. If you have an infection in the anal area, you're going to get anal discharge, itching, soreness, bleeding, painful bowel movements. And usually you'll see development of symptoms just a few days after exposure. So this one doesn't take long in order to present itself. It is a penicillin resistant type of bacteria, so this is generally treated with other antibiotics. Another way that it can be spread, though, is during childbirth. If the mother is infected with gonorrhea, the mucous membranes of the child can become infected because of that crossing of the barrier. Neisseria meningitis, aka Meningiococcus, it's found in the nose and throat, and it causes a whole kinds of things. You've got endemic and epidemic meningitis, meningococcemia, pneumonia, purulent arthritis, eye infections, urogenital infections, rectal infections. It is also very virulent because it is a capsule. It does have pili, making it motile, and it does have endotoxins. And so it's going to be spread orally and through respiratory droplets, coughing, sneezing, that type of thing. But this one, the carrier state can actually last for several months as opposed to seeing it a few days after you've been exposed to it. Then we have, drumroll, Clostridium. Clostridium is of particular importance to the embalmer, and this is something that we're going to see pretty frequently. All of the Clostridium strains are going to be spore-forming bacilli, and they are anaerobic, meaning no air, and or they're infections or intoxications. But Clostridium causes one of our arch nemesis, tissue gas, okay? But it also causes a lot of other really, really nasty infections. So first of all, we have botulism, caused by Clostridium botulinum. And the Clostridium itself isn't what causes you to be sick, it's the endotoxin that's created by the Clostridium. It causes generally food intoxication. And this is particularly virulent because it is a spore-forming bacteria. So this is commonly found in goods that have been canned but not at a proper temperature and pressure. So the the Clostridium botulinum turns into a spore once it's been processed. You open it up, you eat it, it gets into an environment that it likes, and it's all happy and it starts to grow. Um, what botulism can do is it will actually block the release of acetylcholine in your system, resulting in death. Some of the symptoms that you'll see from botulism are paralysis, cardiac failure, respiratory failure, nausea, double vision, blurred vision, difficulty swallowing, and you'll see it come about, somewhere around a few hours to a week after exposure. And botulism is found normally in soil, but it's not always a bad thing. So they've actually figured out a way to utilize botulism to treat a lot of different things. So botulism is the main component, the working component in Botox. Botox is not only used to ease wrinkles and everything else in the face, but it's also used to treat things like migraines and the like. And the way that it works is that one of the symptoms for botulism contamination is going to be paralysis. So if I'm trying to get wrinkles in my face, a very, very tiny amount of the botulinum toxin is going to cause temporary facial paralysis, which gets rid of the wrinkles on my face. Okay. Food intoxication happens from C. perfringens, which can result from improper handling of food and ends up with gastroenteritis, which causes nausea, vomiting, that type of thing. Then we have Clostridium tetanus, or C. tetani. Tetanus causes a condition called lockjaw. And what happens is that this particular neurotoxin, instead of what botulinum does, which was paralysis of the muscle, this one actually prevents the muscles from relaxing. So what happens is that the intoxication will end up in the jaw area, will tend to concentrate in the jaw area, prevents that muscle relaxation, causing the jaw to seize and lock. All right. It is an anaerobic endospore forming toxin, and it is preventable by a DTaP vaccine, which is why, and tetanus is found in the soil. So that's why if you end up with a cut or something like that, you go to the doctor, they ask you when the last time you've had a tetanus shot was, they'll give you a booster because a booster is required every 10 years in order for that to continue to work. Clostridium also causes, like I said, our arch nemesis. Okay, gas gangrene. Gas gangrene and tissue gas are both caused by Clostridium perfringens. This is an endospore, anaerobic, and saprophytic contamination. What happens is that the tissue itself starts to die because there's a disruption of blood flow to the tissue. Also, often happens as a complication from diabetes because diabetes will interrupt the blood flow to a particular area. Well, this particular toxin seems to really love that necrotic tissue, so it starts to feed on that necrotic tissue, causing the continuing growth and thriving of that particular bacteria, and it builds up under the skin, causing these pustules and blisters. What we have here is a live individual with gas gangrene. It causes that fermentation of carbohydrates, and then here we go is the product of that fermentation, just kind of gathering up in these little pustules. Gangrene happens during life. After death, when the same type of thing happens, you end up with tissue gas. And it's caused by that translocation of bacteria and can be spread quite easily through contaminated instruments. Now, this is possibly one of the worst cases of tissue gas I've ever seen. I mean, these are some huge pustules. But you can see that those pustules, once those carbohydrates start to break down, will cause just this blackening to start happening. But at any rate, these pustules lead to what's called desquamation, which is the separation of this top layer of skin from the bottom layer of skin and causing the skin to slip off. Kern bacteria is actually one of the more rarely found infections, but it's starting to become more and more common. So we're going to go over it. It is an opportunistic infection. Okay, it's non-spore forming, it's facultative aerobic, and it's a free-living saprophyte. So it's not terribly virulent, but it does cause diphtheria. And what diphtheria is, it's respiratory and cutaneous, blocks the production of proteins in human eukaryotic cell, and it's spread through droplet transmission. And symptoms are going to be sore throat, fever, red rash on abdomen, fatigue, swelling of neck, bleeding of throat, paralysis. And you get this grayish white pseudomembrane in the throat. And this pseudomembrane usually will coat a good portion of the throat. You can see it's already starting to move over here to the uvula. Okay. And the really cool part about this is the cutaneous version of it right here, just causing that ulcer. Okay. They actually produce the antitoxin for this in horses. So they introduce the contamination into a horse, the horse creates the antibodies, and then it's injected into humans, and for some reason the horse antibodies seem to work. Francisella tularenus ends up in an infection called tularemia. Very, very highly infectious, and it's strictly aerobic, so it loves oxygen. It is a non-modal bacillus, and it's facultatively an intracellular parasite. So some of the symptoms that you're going to get, here is an example of the ulcer right here. Small ulcer and local inflammation, and then about a week later you'll see pus-filled lymph nodes, and then you'll start to form abscesses, septicemia, and pneumonia throughout the body. There is also, from the same contamination, it's also called rabbit fever, and it's spread through inhalation, ingestion, bites, and minor skin breaks. And it's called rabbit fever because individuals that used to handle rabbits on a regular basis seem to be more susceptible to this particular infection. So leading to the discovery that a good portion of the infection comes from rabbits, rodents, small animals like that. Mycobacterium avium is an opportunistic infection that is generally an AIDS-related secondary infection, and it is important to know because I don't know how many of you have a lot of experience with death certificates and looking at the cause of death, but it is not common for a physician to actually list HIV or AIDS as a cause of death or even a contributing factor, because generally speaking, it's the secondary infections that are going to kill an AIDS patient. So they don't list the infection on the death certificate. If you know what some of these secondary infections are, then you know a little bit better what that patient may have been suffering from. So this mycobacterium is going to affect the internal organs first, and then the symptoms you're going to see are weight loss, fevers, chills, night sweats, swollen glands, abdominal pains, diarrhea, and fatigue. It's a lot of the same symptoms that you're going to see with many, many other infections. So it's really not an easy one to be able to differentiate, which is why it's important to know the name, because if the cause of death lists Mycobacterium avium infection, you know it's probably a secondary infection from AIDS. Mycobacterium tuberculosis is a highly resistant, high lipid content in its cell wall, and that high lipid content is what allows it to be resistant to desiccation. This can actually survive for weeks in dried sputum, which is why embalmers are so careful when it comes to tuberculosis. It's it's very resistant to disinfectants and antiseptics and will grow in the respiratory system. And what happens is that it gets into the respiratory system, it attaches itself to the alveoli, and then it forms these little nodules called tubercles. And these tubercles are what cause the inability to breathe. And then the bursting of these tubercles causes the individual to cough up and spit blood. And it is very resistant to treatment. Moving on to spirochetes. These are the causative agent of many zoonotic diseases, and zoonotic, we remember, is caused by animals. Okay, these little guys have a really cool ability. They've got flexible cell walls, which, if you know anything about cell walls, is almost a contradiction because the cell walls actually provide structure. So it's kind of neat in that regard. And then it's got motility in liquid. So what it causes, you've got Leptospira intergens, also called leptospirosis, causes kidney and liver disease in humans. And it comes from coming in contact with contaminated animal waste, generally spread through water systems, and can survive in neutral waters for weeks because it's got this motility in liquid over here. It enters the system through skin breaks or mucous membranes, and your symptoms are going to be headache, muscle ache, chills, fever, and then a more severe version is going to be Wales disease, which is systemic, can be fatal. You end up with renal infection, hepatic infections, central nervous system infection. Okay, so if it's left too long, you can actually require a pacemaker because it can cause damage to the heart, causes arthritis and nervous symptoms, or nervous. So it happens in 3 stages. The first stage, you're going to get this ulcer forming, which we talked about right here. The secondary phase is going to be hair loss, swollen lymph nodes, sore throat, malaise, low-grade fever. And then the tertiary phase is going to be these lesions that appear affecting the brain, eyes, heart, blood, bones, joints, aorta, and loss of motor control, central nervous infection, also psychotic behavior. They actually blame some of the historic mad characters. They blame a lot of the psychiatric disorders on syphilitic lesions of the brain. Cholera, Vibrio cholerae, most often found in contaminated seafood. Okay, so areas with a good portion of their diet based on sea-type animals will see higher instances of cholera. If left untreated, it has a 50% mortality rate because what happens is that it'll grow in the small intestine, produce this enterotoxin that secretes chlorides and biocarbonates in the water, and you end up with what is called rice water stool, where you have some stool in there, but most of it is the water being expelled from your body. And death ultimately results from dehydration, not necessarily the contamination of the toxin itself. Bacillus anthracis is the cause of the anthrax contamination. And just, pro tip here, if you're going to Google anthrax, you have to Google anthrax infection. Otherwise, you're going to get nothing but the band coming up. But it comes in 3 forms: cutaneous, inhalation, and GI contamination. The Bacillus anthracis is actually found in farm soil. It's fairly easy to isolate. All you have to do is take farm soil, put it on a petri dish, grow it for a little while, isolate anthrax, and replate it, continue to grow it. It's actually incredibly easy. I probably shouldn't tell you that. Anyway, it enters the skin through either broken skin, insect bites that become infected with spores, and the lesion actually develops this ring of blisters around a dark center. which eventually just kind of ulcerates like this one did, dries out. So you've got this black center starting to dry out here along the sides. 2 or 3 weeks later, this little Escher, this black spot will actually fall off and just leave a scar in the area. So that's not really the most severe form of anthrax. However, when it moves into the lungs, in 2 to 5 days, a respiratory infection will occur. Then you've got sudden respiratory distress, respiratory failure, and death. So that is one of the more severe forms, which is why individuals that are using anthrax as a weapon tend to send it in a powdered form, so that when it opens and becomes airborne, inhalation causes the issue. And if it's ingested, you end up with abdominal pain, nausea, anorexia, vomiting, bloody diarrhea. And since this particular one has symptoms that are so common to other types of infections, it's really difficult to diagnose, and that leads to a high fatality rate because the anthrax isn't being treated. Bordetella is also known as whooping cough or pertussis. It is one of the most highly communicable childhood diseases that you're going to find. Adults that get it tend to be asymptomatic unless they're immunocompromised. My father had a heart transplant about a year ago, and the first thing that they told us to do was to go get a DTaP booster, because with the medications that they give him to suppress his immune system to keep him from rejecting the new organ, he becomes then susceptible to things like whooping cough. So this DTaP vaccine vaccinates against diphtheria, pertussis, and tetanus. Initial infection takes about 2 weeks. It's a mild respiratory infection, and then a couple weeks later, you get this initial phase of whooping cough, where the alveoli start to swell. You're getting into these violent coughing episodes, and then you get this whooping noise in between each cough. So you're like, whoof, whoof, this whoop. And then last phase is the violent coughing episodes. Enterics, this is a fun little one. This contains Escherichia coli, or E. coli. It's normally found in look at these little guys, aren't they? They're kind of cute, actually. Anyway, it's a normal bacillus that's found in the human intestines, but it's incredibly motile because it's got both chelae and these fimbriae. Okay, so it's got these little chelae that let it move, and then these little arms, these fimbriae. So it's incredibly motile. And there are 3 common illnesses associated with it: traveler's diarrhea, enteroinvasive diarrhea, and enterohemorrhagic diarrhea. All diarrhea. Okay, this traveler's diarrhea is generally found in subtropical environments due to poor water sanitation. And you'll find it most often presenting symptoms in individuals going from developed countries to non-developed countries, because they don't have the same antibodies developed for it. So if you're accustomed to clean water and safe food handling practices, you're more likely to get sick going into a foreign country, an undeveloped country, and eating the local food, drinking the groundwater. Enteroinvasive diarrhea is going to be person-to-person fecal-oral route, causes severe fever, abdominal cramps, malaise, watery diarrhea with pus, mucus, and blood. And then the hemorrhagic penetrates the intestinal wall, leading to more blood. Klebsiella pneumoniae is also a normal intestinal flora. This one is non-motile. And it possesses this, this is the cool part about this one. It's got this cool little polysaccharide capsule that is resistant to these human phagocytic cells. And remember, these little phagocytes are the ones that would come and encompass the, oh my gosh, I have a dry throat, come and encompass the infection and send it back out. So And when you're putting antimicrobials into the system, this polysaccharide capsule retards the absorption of that. It causes lower respiratory infections, and if you're immunosuppressed, you can get a UTI, wound infections, outbreak in nosocomial infections in newborns. Okay. Food infection, you've got Salmonella gastroenteritis. And what happens is that it's going to be ingested and it'll grow by attaching to the cells in the GI tract via these little fimbriae. I don't know, I just think they're really cute. And you end up with the symptoms of fevers, chills, abdominal pain, watery diarrhea. Salmonella will generally come from contaminated meats and eggs. Poultry is famous for the spread of salmonella. Typhoid fever comes from Salmonella typhi, and Salmonella typhi is not found in animals, despite the fact that you've got the little salmonella there. It's acute, contagious, and it's part of the digestive system. You end up with these necrotic lesions all over the place in Peyer's patches, mesenteric glands, spleen, and it incubates for a couple of weeks. Once again, fecal-oral transmission. Most enterics are going to be fecal-oral. You'll end up with prolonged fever, headache, abdominal pain, nosebleeds, and this white furry material on your tongue, and as well as discoloration on the tongue. And last but not least, we have bacillary dysentery, okay, which is also just called dysentery. Anybody that ever played Oregon Trail as a kid? I just found this highly amusing. But you're all much younger than I am, so probably have no idea what I'm talking about. At any rate, dysentery is anaerobic, and it's found in the intestines of humans and primates. Fecal-oral spread, once again, ends up with severe diarrhea and blood and mucus in the stool, but this one isn't as severe because, well, you're going to get symptoms 24 to 48 hours after exposure, but dysentery can be treated easily with antibiotics. Yersinia pestis is going to be the causative agent behind the bubonic plague. Bubonic plague is also called Black Death. It was the cause of massive infection and die out during the Renaissance period and even after. And believe it or not, you still will see a few isolated cases here and there, semi-regular basis, okay? Causative agent is, it is the causative agent anyway, spread by rats and fleas and contaminated rodents. It has a mortality rate of about 50 to 75%. And it happens from being scratched by an infected animal or skinning an infected animal. Some of the symptoms you're going to see are going to be hyperplastic growths of lymph nodes, and these are called bubbos, and they're just these big growths. Death usually happens in less than a week if it's untreated. You get dark hemorrhagic areas and areas of necrosis, like you're seeing in the fingers here, okay? And there is this false story that Ring Around the Rosie is referring to Black Death. You know, Ring Around the Rosie, which is some of the red rashy areas that come with the particular disease. Pocket full of posies because they used flowers to ward off smell and ward off infections. Ashes, ashes, we all fall down, referring to the burning of the bodies and the burning of the houses after the infection was there. It makes sense, it's cool, but not actually true because the song wasn't actually ever written down until maybe like 500 years after the Black Plague went through. So, you know, cool story, not true. Then you have Haemophilus influenzae. It is the cause of influenzal meningitis. Highly virulent, non-motile, but it does have unique capsules and antigens on the outer membrane that paralyze the sweeping motion of the ciliary cells within the respiratory system. So those ciliary cells tend to sweep all of the contaminants out of your lungs and out through coughs. And this will actually paralyze that, causing the infection to set in and stay within the lungs. Symptoms are going to be irritability, poor feeding in infants, fever, severe headaches, nausea, vomiting, pain and stiffness in neck when flexing, pain in back when the chin is pointed towards the chest like this, unusual body positionings, and sensitivity to light. It's not actually related to what we typically think of as influenza, because they falsely thought that it started a flu epidemic at one point, but it didn't. Usually infects individuals from 6 months to 6 years of age and is caused. Okay, so at any rate, it's comes from an agent that is related to the Campylobacter jejuni, but also Helicobacter pylori. And the gastric acid and enzyme pepsin act on the mucosal lining of the stomach, kind of stripping it away and causing damage. Last but not least, we have Legionella pneumophila and Listeria monocytogenes. Now, the Legionella is also called Legionnaire's disease. We talked about this a little bit earlier in the lecture. Symptoms are high fever, cough, symptoms of pneumonia, and it comes from infected water sources. And we talked about Flint, Michigan, where they had an infected water source that came in, and they recently had an outbreak of Legionnaire's disease. Can result in what is called cardiovascular collapse. We then have Listeria, which are non-spore-forming bacillus. They're a foodborne pathogen. They've been in the news quite a bit lately from Listeria infections in produce, mostly in spinach. In healthy individuals, they generally tend to be non-symptomatic, but anyone that's immunocompromised can be deadly, can lead to fatal meningitis, and it thrives at refrigerator temperatures. All right, guys, that's it for this week. Don't forget to take your quiz for this module, and we will see you next module.